Hey, I want to talk about a subject that means a lot to residents, and I know this because I experienced it myself. When I was first starting out as an administrator in training, I remember I went one weekend I took and I dedicated it to just seeing what it was like living in a nursing home. So I donned the old gown and I just stayed in a room and I sat in a wheelchair all day and slept in the beds at night, and I ate the food that was served to me. And I didn't do much. I got bored mostly, and I came to just looking forward to every meal. It was like I was really looking forward to every meal. That was like pretty much my only thing I could look forward to. And I can't tell you how crushed I was when one lunch, all I got was like, the main entree was like a slice of salami with 2 white pieces of bread. And that was the main thing. And I was like so disappointed. I remember how I felt. And it means a lot. And that's why, as an investigator, nursing home, the food complaints would be like one of the more common things you get all the time. For a lot of reasons, I mean, some places have good cooks and some don't, Some use these young teens and they don't know what they're doing. And they can have different quality of ingredients too, it just depends on the home. And it's tough for a home because, a lot of times they can't season stuff. They can't be salting stuff up because you have some people that are supposed to avoid salt and other things. So you have to make it kind of plain. But, you as a family member, you can sometimes make it a little better. I mean, if somebody's on a regular diet and you know that they're going to serve some food they don't like on a certain day of the week, you could maybe pony up and get them a little something, order up some food that's delivered to them, a little surprise, make them, something for somebody to look forward to, in their final years. Wouldn't hurt. Do those little things or bring in stuff. I talked about food preferences before. Well, people have those preferences. You can bring those little foods in for them, or those drinks or whatever they want. It's always nice because you want them to maintain their weight. But as people get older, it gets harder for them maybe to feed themselves, so they start having maybe problems swallowing. And so the doctor will order a modified texture diet. Usually it's a mechanical soft diet, which means they're just kind of grounding the food up, or it's a puree diet, which is blended food blended in the consistency of like a pudding or something that'll just stick to a spoon in a smooth setting. And it's not so satisfying, especially when it's pureed, because it doesn't, the texture isn't what it would be that you'd want to have. And it just isn't very appetizing to see these globs on your plate, especially when you're older and you might be at risk of malnutrition or weight loss. In nursing homes, they have to check, or they check like monthly their weights. So, as long as you have that durable power of attorney for healthcare, you should be able to find that out, see are they losing weight. That's always good to know that. If they are having problems with their weights, you want to talk to them about what interventions are in place. Typically, they'll do things like, maybe they'll fortify with extra protein powder, maybe like oatmeal at breakfast or something at lunch. Find out the meal they usually have the best eating at. They tend to eat, people will have a preference for eating more at certain times of the day. We'll get that extra protein enhanced food maybe at that time of day. A lot of times facilities would add like an Ensure drink with their Med Pass, just a small amount, just a little something in between, or other snacks. Purees, a little something. And this is just, my opinion, because I was telling you about how, they're just, if you've ever tried them, they usually leave something to be desired, But if your loved one is really losing some weight, there's stuff that's made that you can make with puree and it's really going to taste good, but it may not be considered, like health food. Like, there's so much you can make with milk, sugar, and eggs. Now, like I said, it's not health food, but you know what? You get your calcium, you get your fat, and you get some protein with that. So, if you're losing weight and being at risk for pressure sores, well, you want to get some protein. You want to get some fat. Get that on your bones, There's puddings and cakes and fillings that you can kind of puree, and they would taste probably delicious. In my book, I've got all this all laid out. There's different vegetables you can puree that are going to be good. Potatoes that would be good pureed, and spice up with a lot of butter. There's fruits like strawberries and bananas, and then you can thicken that up however you need to make it like a puree. You can even puree ice cream, I found out. You just let it melt. You put some of that. There's powder that will thicken food, and you can even puree that. But whatever you do, because your loved one's going to have a certain ability of swallowing or not, make sure you just check it with the speech therapist who assesses their ability. And whatever you bring in, get their green light and communicate with the DON about what you're doing, and make sure that everybody's on board and they're okay with that, because you don't want to be giving them anything that they can't swallow or are going to be coughing up or choking on, and you don't want to make anybody uncomfortable. They want to be, like I said, always build that good rapport. It all starts there. You get a good rapport. You're up front with people. They'll work with you. You want to do the same thing here, right? The challenges of people eating and getting enough food happen for two reasons. They happen because maybe physically they cannot feed themselves, or mentally they're not capable of doing it. They get too frail, they can't feed. They get too confused, they can't feed, and then they can't access the food, so they have to be fed by staff. And then you're concerned, well, are staff actually feeding them? You don't know. So you can go in the evening hours, and you can see that's usually when it's a little bit more challenging. There's fewer staff there, and they're obviously going to feed your loved one when you're there, or you're going to feed them. And you can observe then, okay, I see this other lady at another table, and she can't feed herself. Are they helping her? If they're not helping her, they're probably not helping your loved one when you're not there. So maybe have a discussion if you're seeing that with the DON about what you're observing. And maybe you just need to be on board more, going there more often, to observe what is happening. Hate to say that, but that is the reality sometimes. And like I said, sometimes with a staff rapport, you build that rapport. You talk to aides, talk about your loved one maybe losing weight and being concerned and that they need help, and you emphasize that. They get it clear in their mind. All those things are helpful. Oh, the last thing, and probably the most important thing is, like I said, remember those preferences. Hey, let them know when they're starting to lose weight and there's an issue with their weight. Let them know about the preferences they had about eating when they were out of the nursing home. What meals they ate the most at, what foods they liked. Try to accommodate that. Even go to one of those care plan meetings they have. They should have like a care plan meeting every 3 months. Go to there and make suggestions about food items that they might like to have, and try to make sure that they incorporate that in their diet so they'll eat better. Okay, so hopefully you got something out of this one. If you like it, go ahead and give me a thumbs up, please. Share it with anybody that might be benefiting from it. And if you want to learn more, go to www.nursinghomerisc.com. That's www.nursinghomerisc.com. See you in the next one.